Thank you for joining us this afternoon.
Okay, this is fun to do again. Here we are in like week 7 or 8 or wherever we are of getting to know our spouses better, as I call it. The update that I want to do is really going to address 2 important things, I believe. One is, and I can really go on what is my experience for the last week. And last week we addressed the concept of, they call it reopening. For some firms it is reopening, for others it's expanding, but it's how are we transitioning back into doing business, and how are we going to do it in the new environment. What we've had given to us, and I think the best place to go, is the Center for Disease Control. And I'm going to go back to that because overall it was a little overwhelming to look at it last week, but it's something that you should be thinking about. But I want to make one comment about more of the finance side that I've been working on this week and received a lot of calls. And it is from not a technical viewpoint, but from a legal viewpoint. People are really getting their PPP. I love that, the Payroll Protection Program money flowing into their accounts. And some of these amounts are substantial. We're getting hundreds of thousands of dollars suddenly showing up in an account. From the legal viewpoint, I think it's very important to remember that when you signed up for those loans, if you did, you had to make representations about what your needs were, how would you use the money, and what you have to do to get it back. And people should be very aware that what you've pledged to do, and you've said that the reason that you're getting the money is that the current economic uncertainty makes the loan request necessary to support the ongoing operations of the business. I've heard a lot of people say, well, I've received the money, I don't know what we're going to do with it, maybe I'll just keep it and then pay it back. Well, here we have the catch-22, which is when you made the application, we didn't know what the future was going to be. In fact, it was probably weeks ago and we didn't understand what expected severity be, nonetheless, what the severity would be for your business. But remember that you've got a pledge out there saying that you thought, at least at the time, you need it for ongoing operations. And they specifically say that you can use it to retain workers, right? Maintain payroll, make mortgage interest payments, lease payments, and utility payments. I've had people ask me, it's like, well, I'm not going to have enough. Now, obviously people want to qualify to have this paid off. And you really have to go back and look at the first part of this and say, okay, I've got to use this for these purposes because that's what I pledged to do. And the daunting part of this is that it says, I understand that the funds are knowingly used for unauthorized purposes, the federal government may hold me legally liable for such as charges for fraud, right? And further on, they explain that under the statutes, fraud and some of these violations are punishable by imprisonment of not more than 2 years and or a fine of more than $5,000. But if it's through a federally insured institution, the imprisonment could be 30 years or $1 million. So this is really serious business to make certain that you're using the funds in the proper way and that you account for them. You have to document them. And further, then you make certain that you hit the loan forgiveness and do it properly. I call it stage 2 of the entire program, which is what money do I not have to pay back? And the general rule is you cannot use more than 25% of the loan for non-payroll cost. It has to be for the other means. Really take a close look at that if you have the PPP and pay attention to it. It is serious business. As I think there was even a front page article in the New York Times on Sunday about some of these things. There's a lot of misinformation out there. But from a legal viewpoint, it is these representations that you made to get your loan which I would say would concern me the most. With regard to—
Can I ask you a quick question on that, Dennis?
Sure.
So, and I know I brought this question up, I think we had it 2 weeks ago, on whether or not there was going to be some type of an audit, or do I have to prove that my revenue was decreased? So if you're saying that we made these pledges that effectively say is that at the time of the application, I understood that I need to have these dollars come in so that I can maintain payroll, employees, et cetera, the things you just said. However, if it turns out that the revenue of the organization, say, hasn't changed very much, or the operational aspect of the organization hasn't changed very much, are you saying there could be tension there where even though I can earmark and say I am paying this money that I receive for the PPP towards payroll and towards leases so I can make my ratios, but effectively, if I can't prove on the other side that I have had some type of impact, then I'm going to be outside that pledge that I gave, that because my business certainly was impacted, and so now I really have a windfall of money that I would have been using for payroll that now is sitting in my bank account.
Sure, and I think that's an interesting question. The regulations use this language. They say when you make the application, current economic uncertainty makes this loan request necessary to support the ongoing obligations of the applicant. Now, fraud requires special intent, what we call scienter. So they would have to show that you intentionally lied at the time you made the application. But I do have some businesses that were concerned about what was going to happen, and then they haven't suffered a loss of revenue. And so even though the economic certainty at the time they made the loan request might have been made in good faith, you're asking what happens if you were wrong. And now
Correct.
You go to the next stage, you have to use the funds to retain workers and maintain payroll. So is there a tension or explanation about if you really did, you in good faith applied for the money and took it, but you didn't really need it, but you only found out that later, are you defeating the spirit of the law and violating some kind of pledge? I think it's possible. I think it's possible that they might look back and say, well, you really didn't need the money, and so we're going to ask for a repayment of 1%. That might happen. And always remember, things in regulations change. We're going to have an election in the fall. We could have new people appointed to run these programs. I don't know. I think Matt would say the same thing. I think we've discussed this, which is that right at the moment it's unpredictable, but the issue that you're pointing out is there. I think certainly, the intent of the program is to get money essentially to the workers as a substitute for unemployment insurance.
Right.
And if you're not using the funds and you have no need for them, absolutely the safest thing to do to meet the intent of the law is to repay the loan early, right?
Okay.
So just be aware that those issues are there.
Okay, thank you.
With regard to going back to work, which we hope everybody will do, the message that I wanted to send last week, and it's stated very well in the CDC interim guidance, which we have up here, which I think as you're doing this, everyone should get that document and look at it. And its message is that you need to have a plan. You need to, as for any crisis, and I'm used to this in terms of looking at cybersecurity, everyone needs to have a cybersecurity plan now. To analyze privacy, to protect yourself. And to do that, generally, you need to put together essentially an internal program that analyzes the problem in your industry. The CDC has identified the three main areas. If you're going back to work, you better reduce transmission among employees. So, for example, I work with a swimming group, and it's going to have to look and say, how do we keep our coaches safe, right? Are we going to be able to keep our coaches apart? You're going to have to look at your own workers. Next, maintain healthy business operations. Well, not just to use the example at a pool, what do you do about locker rooms? What do you do about bathrooms? What do you do about the deck? You're going to have those same issues. And then to maintain a healthy work environment, that really is going to deal more with how you deal with the public and with vendors and with others. To do this, you need to have, I think it's 2 steps. You need a committee and someone in charge, and you need to involve different aspects of your business to address these problems, and you should put your plan in writing. As I said, I read one that was like Audi going back to work was over 100 pages easily. My advice too is that these are very industry specific. I've seen school guidance plans. I've seen USA Swimming putting out one. You see the National Restaurant Association. Find those guidances that help the industry that you're in or that relates to you. And we want to focus on one aspect of this today, which is in dealing with your employees. This will go to number 2, maintain healthy business operations. One thing that you need to do is to analyze your human resource directions, your employee manual, your current policies as we face the coronavirus challenges at the moment and the new laws that we face. Plus, we're going to have so many different circumstances where you have a healthy worker who's living with someone who is vulnerable at home, or if you look at labor and employment, it's the unusual situations which inevitably come up, and there are many of them. And so you need to look at your HR policies at the moment and try to modify them for the moment to fit the situation. And those are issues I think Diane has been facing in the last week. And so I will happily let her address some of those, and I think she can tell you a few war stories.
Can I ask one quick question?
Certainly.
You'd mentioned for creating, or maybe this is better served for Diana, but making updates to the policy handbooks, manuals, etc. It's not on a temporary basis, right? I mean, there's certainly an opportunity where, maybe in the very near future, if there's another outbreak, the states are going to close. But it's also kind of addressing an unknown in the future that you may be in a situation where you're either told to or you're need to close the organization for one reason or another. So is it an update for COVID, or is it an update kind of just globally to make sure that we can address something like this in the future?
I would say that it is both. I would do it in the context of your response plan that you're putting together. And, certainly, we can't expect, and I think it would be unrealistic for the purposes of creating a plan to have one of the solutions to be a Tinkerbell solution where this goes away. It's more likely than not going to happen, in the immediate future. It could go on for some time. And certainly for planning purposes, in creating this plan, you need to assume realistic scenarios of what's going to happen. Will there be another outbreak? And even then, I mean, we focus so much in our discussion on peaking and hospitals. Well, that's not our problem at the moment. That's the public health problem. But even if it peaks and declines, it's still ongoing. And so if you're vulnerable, you're very, very concerned. When is somebody 70 years old going to be willing and rational to go jump on an airplane? That's a good question. When they're going to be treated differently. So we really at the moment have no real way of even estimating that future. As I said, one classic distinction is to look at risk in business, but risk is something that you can quantify. This is about uncertainty, and your business plan has to has to deal with uncertainty about what the future is going to be, something that we can't quantify at the moment. And that's the real challenge we're facing.
All right, thank you. Are we transitioning to Diana now? I believe we are.
Yes, please.
We are, and it's a perfect piggyback on what I'm thinking of as the HR person for clients, and as we continue to look through all of this, and how do we continue to figure out how do we go back to work and make our workplaces safe and be able to move forward and work in this new normal. So first slide just kind of goes over what has opened here, at least in Arizona. So Governor Ducey pushed out our shelter in place until Friday the 15th of May. I don't expect us to get an additional update on that until probably the 12th or 13th on what he will do beyond the 15th of May, if he will let everything open up, or if he will extend it and continue to open pieces up bit by bit. But he has opened up a few things for us. So elective surgeries were effective on May 1st, that hospitals and medical facilities could start opening up to see non-emergency patients. And I know this includes medical, dental, and vision. I working with several dental offices and getting opened up to be able to see patients on a regular day-to-day basis. I know eye exam and vision cares are starting to open up. As long as they have the PPE pieces in place, that they are taking the sanitation guidelines seriously and making sure that everything is staying clean, that the social distancing is still happening, that in those areas like hospitals and such, that testing is getting done before surgeries and those types of things are happening, that most of those offices are starting to open up. And then as of today, retail stores that sell goods can open up. Till Friday, they're allowed to do delivery, window or walk-up service, drive-through, drive-up, and curbside service. And then starting on Friday, they can expand to in-store, in-person operations, as long as the stores are implementing the social distancing and sanitation measures. I'm going to guess, just like I know starting today at Costco, you have to wear a mask before you're allowed in the store. I would expect to see that at other retail operations, that wearing masks will become required as we continue forward into the summer. And then the next piece would be restaurants.
Can I ask one quick question?
Of course.
And you said this is if you have a good or a service, no, a good that you're selling, not a service.
You're selling goods, correct.
So I'm going to have to eventually succumb to Kathy cutting my hair because I still can't go to a barber, is what
Correct.
I'm hearing you say?
Yes.
Okay.
As of today,
Okay.
Correct. Kathy will have to cut your hair, or cut yourself. Cut your own hair. So it's good.
What if the
so
Flowbee has made a comeback?
It's the clothing stores, the Old Navies and the Ultas, those types of stores that sell goods can start opening up. DSW for shoes, those types of stores can start opening up on a voluntary basis. They don't have to. This is all voluntary for them still, because the shelter in place is in effect until 5/15. But I would expect to start seeing stores figuring out how to make this happen and what it means to them to open up. And then I know that the governor and the state is working with the Arizona Restaurant Association to figure out what those guidelines, and he mentioned in his discussion last week that May 12th would be potentially the start date of dine-in services. And what does that look? Is it 25% capacity of restaurants? Is it 50% capacity in restaurants? So hopefully we will get more details on what that looks like. And I'm sure the restaurants are all busily trying to figure out how to make that happen while following social distancing and sanitation measures. And how do you wait on people and try to keep that social distancing happening. So more to come on how Arizona will continue to open up, but we will get there. So kind of going along with what Dennis was saying with regards to having, you know, a committee. So you should have a response plan committee and a return to work committee created. And this is just some guidelines on some of the things that you need to think about as you continue to look at bringing employees back to work and all of the areas that we have to look at. So the first thing that we have to think about and look at is workplace safety. So how are we going to, or are we going to screen employees? Are we going to take temperatures? How are we going to manage that? You know, the exposure response plan, we should have a full plan on, as he said, not just for this time around. COVID's not going away. This isn't going away. So how are we going to manage this in the future? And what is our process if we do have an employee that comes to work and then we find out later tests positive? And how do we manage that process? You know, are we going to provide all of our employees with PPEs? How are we going to manage physical distancing in our offices? Cleaning procedures and making sure that surfaces are being wiped down and cleaned on a regular basis, working with our cleaning crews in the offices to make sure that they're coming in more often and cleaning surfaces on a more regular basis. There's also the OSHA record keeping processes and the obligations of employers in recording illnesses and injuries in the workforce, and what does that all mean?
And let me interject there real quickly. OSHA does have a guidance for cleaning and maintaining the workplace. That's a document that you'll need. If you want to email me, I can email it to you or email you the link.
And it's like a 35-page document, so it's very thorough in what they're expecting companies to try to do for workplace safety.
Is that the document you shared with me this morning, Dennis? Or actually, I think it was early afternoon?
Yes.
Yeah.
Okay.
Then we have to think about the recall procedures and how do we, when the shelter in place is lifted or as these retail stores are opening, who and how do we bring our employees back? You know, what are we looking at? How do we make those decisions on who gets to come to, who needs to come back into the office? Do we do a staggered schedule process? Do we, if you're in an office situation, does some employees come back on Monday, Wednesday, Friday, and another group comes in on Tuesday, Thursday, so you can keep that physical distancing around? So then people work from home part-time and they're working in the office part-time. How do we handle those high-risk category employees? And what do we do for those? How do we handle employees that are unwilling or unable to return for a variety of reasons? They don't have childcare, or they are just afraid, or the shelter in place isn't open and they're not ready. They're not willing to leave their house yet until that is. And then continuing the remote work, and how do you continue to make that happen? This is where one of those areas of policies, most of us started remote work or telecommuting with our employees, but never put in a policy. So this is one of those policies that it's definitely time to look at and add to our handbooks, not just for today, but for ongoing, and how are we going to make this work? Next slide. Other things that we have to look at as we continue to bring employees on is our employee benefits and compensation. So is our health insurance, do we have a rehire eligibility provision or amendment in our plans so that benefits can start when they're rehired, or do they have to follow the eligibility rules just as any other new hire would be? How do we manage the FSA accounts that they may have had, dependent and medical on their FSAs? 401k plans, are there eligibility issues with regards to the layoff or if they were furloughed? You know, is there another waiting period or a break in service issue that we have to look at? And how are we going to manage all of the paid leaves, not just the FFCRA, but we also have most states have us paid sick leave provisions now, PTO on vacations. People haven't been able to use it. We probably won't be able to continue to use it for a little while for traveling. What do we do with those accruals and all the carryovers and things? So we have to look at those. And then compensation adjustments. How are we handling? Are they going to have hazard pay? What are we going to do about the salary reductions that we may have put in place? Are we going to look at maybe doing bonuses for those that do return, or if they would have been eligible for a bonus while we were closed, are we going to do those now, or are we going to make pay increases, merit increases, if they would have been eligible while we were closed or while we were in the shelter in place? So it's another area that we really have to look at. And in all of these things, we have to make sure that we are doing frequent and clear communications to all of our employees, letting them know when we're opening up, what does that look like, what processes and things are we putting in place, what does that response plan look like, what are the cleaning criteria that we're following, the CDC guidelines, social distancing, physical distancing process. So making sure that we're communicating all of that. And again, this is that time where updating our handbooks and making sure that all of our employees are aware of what's in our handbooks, are updated and accurate to what we're doing in this new normal of running a business. I think that's all I had. So lots to think about. And as Dennis said, looking at industry-specific guidelines as well during this process.
I got a few questions for you, Diana, or maybe Dennis, this is you as well. And I'm thinking it may be addressed in that OSHA handout that you had mentioned you sent to me this morning. But this one are there different things I need to receive from my cleaning service? So in other words, outside of having a conversation with the cleaning service, is there any new type of certifications, or is there some type of proof that I'm supposed to be getting from that service so that I can have that posted or shown to employees so that they feel confident that the office is being cleaned in a specific fashion? And then part two of this question is that if I only have periodic cleaning of the office, is there something that I need to do to make it more frequent? So it's kind of a two-part question we received.
Sure, that's a very good question. And then that goes to the initial statement here when I was talking about putting together a response plan. Certainly one part of the response plan is addressing the facilities. And part of addressing facilities and the general response plan is addressing your third-party vendors that are out there. Cleaning service would be one of them. And you'll have different issues. For example, I know we have our building who contracts with the cleaning service rather than us, so we don't have control of them because we'll have common bathrooms. Certainly that cleaning service, you are going to want a certification from them that they're following what are OSHA guidelines. And then you're going to have your own responsibility for your own business. For example, I can think of our building that has a primary care medical facility on one floor. The cleaning problems they face would be different than obviously, our typical kind of an executive offices where we just pound on computers. So it is very industry specific, it's very site specific. And yes, you would have to take a look and understand the OSHA guidelines because of what changes are required in cleaning practices that we have today to respond to the virus. And you have to make certain that your cleaning service is there. And certainly frequency of cleaning is one problem. And you know, for example, when you have shared bathrooms in a building, now you're going to have to put pressure on your building owner to make certain they're complying with these guidelines. So that's what I'm saying, putting together a response plan and systematically working these issues piece by piece and reworking them is going to be required. Does that approach the question, I hope, because there's no straight answer, no simple answer. It really does require a lot of continual analysis.
Well, and I think employers also need to be thinking about if we have a shared kitchen area, how are we going to manage that? Or shared water coolers, how are we going to keep those clean? And making sure that we have, as an employer, outside of our cleaning crews, cleaning supplies available for employees to also be wiping down tables after they've had their lunch at them, or their desk areas, that that they're also cleaning up after themselves and cleaning areas that they're using on a regular basis outside of just
conference tables. Yeah.
Conference rooms, front desk, doorknobs being wiped down during the day after visitors have come. Those types of things will also need to be looked at during this response, in their response plans.
And I had another question come through, and I think this is an extension of a question we had last week where we were talking about kind of the competition of the unemployment levels versus some hourly workers. So if I'm attempting to bring employees back and they are declining, is there something I'm supposed to be doing as an employer to be notifying the unemployment office that I do have jobs available? Or is that something that the unemployment office is going to be doing directly with them, the employee?
My understanding is that the employer should be reaching out to the unemployment offices and letting them know that they're bringing employees back, that and if someone is declining to come back, that then they would not continue to be eligible for unemployment because there is job and work available to them. So it's on the employer side that they need to start working with the unemployment insurance organizations to make those determinations.
Okay. And then the next one is understanding you're mentioning possible increases on hazard pay. Can that be flipped? Is there, and I guess this is probably an employer-specific question, but is it permissible to be reducing my employees' pay if they just want to continue to work from home on an indefinite basis? That's probably more of a situational answer than a group answer.
Yeah, and I think it's also a Dennis question, and there's legal implications to reducing employees' pay on a ongoing basis. I know, a lot of employers did salary reductions temporarily during this time, or they provided hazard pay, especially for those that were essential workers in grocery stores and delivery services for a period of time. But I don't know that, and especially in an exempt versus a non-exempt, of reducing their salary indefinitely because they're now wanting to work from home versus in the office or vice versa.
Right. You certainly should consult your lawyer or HR professional, because if you reduce salary, the first trap is that you may not meet the minimum pay requirements to keep somebody qualified as exempt, meaning that in the negative world of the Department of Labor, you lose exemption, you have to pay overtime. So I like to just think of it as eligible for overtime or not eligible for overtime. If they are not eligible for overtime, which is what we call exempt, there are minimum pay requirements. So if you reduce salaries, you have to be very careful not to suddenly have major person eligible for overtime and doing something which could cause all kinds of Department of Labor issues in the future. If you're taking on a PPP loan, you can't reduce salaries. You have to maintain salaries. So you need to be aware of that. Hazard or bonus pay, I would just call it bonus pay. If you have a PPP loan, then you can use the loan to pay for salaries to maintain workers. And especially today when Congress has increased for the short period unemployment insurance, it might be necessary to pay people more simply to get them to come back to work because they do so well on unemployment comparatively, depending on what level they're in. And certainly there are people, and thank goodness for first responders. But there are people out there on the line, at the grocery store, who are perhaps more exposed to the virus day to day than first responders. Is it okay to pay them more? Absolutely. Now, and here's the question that the PPP loans cause, which is people are saying, well, it's free money. I can pay them up to is like $8,333 a month. But if you start doing that, and it's beyond what's necessary to maintain your workforce, are you violating the pledge that you made when you signed on to the loan? So you do have duties and responsibilities under the PPP when you determine how much you're paying, and it's not just spending government money. So yes, you can change salaries for the amount of work that's done. You can change pay. The general rule is at will. If it's at will employment, you can change at any time, and the employee can leave at any time. But there are, the proverbial potholes along the way, which currently are very complicated.
Can we reverse that question, and instead of having individuals that want to continue to work at home, let's flip it to what are the best strategies to manage the employees that are in a high-risk category but are unwilling to stay at home, that they continue to come into the office?
That's a fun question because, we have certainly a broad spectrum of outlook that people have on the severity of the virus. There are, those who might be hiding at home for months. And there are those on the other end who think that this really isn't that severe and that it's overly hyped, and there's everyone in between. If you have an employee who is at risk but wants to come in, that's a good question. That's the what if you have an emergency room physician who's 70 years old and still wants to work? Would you let them do it? Can they decide to do it? I think the dividing line for the employer probably should be that you have to keep people from coming into work if they're symptomatic or if they are meaningfully exposed. And they have and let them know they have a duty to inform you if they're meaningfully exposed. That is, they are living with someone at home who gets a case of coronavirus and starts suffering the consequences. And then it is perfectly reasonable to assume that that person has been exposed. Because quite frankly, even when somebody's asymptomatic, we have no understanding right now of how long or how they will be a carrier. Even if somebody is recovered from coronavirus symptomatically, We do not know how long they'll be a character. We're estimating 14 days. I think at times that number keeps coming up. I'm not quite certain of how the strength of the origination of that number, but I don't think it's very strong right now. So yeah, those are the kind of things that your human resource policies need to be adjusted for and planned for.
Do you think it's appropriate
this will be very valuable, obviously, for flu season also,
right.
which we haven't taken seriously, I think, enough in the workforce before, and I think that we'll be more sensitive to that in the future. So, making this kind of determination now will help us as we get through other viruses.
Do you think it's a fair statement, Dennis, that if I as an employer are following the CDC guidelines in keeping my workforce or my workplace, my facility clean, and then to Diana's point, communicating clearly on what our processes, our P&Ps are going to be. And so from an employer's perspective, I'm doing the things that the CDC has recommended I'm doing. Is it unrealistic to have an employee that who might be high risk, who refuses to work from home? Would it be appropriate to have them sign off on something, or is that just kind of putting in ink something that may be really hard to prove later? Or just give them a notice saying these are the things that we're doing to protect our workplace, and it's your will to continue working here when we're recommending you don't?
Yeah, I think that obviously, as a matter of proof, this is the viruses are difficult.
Yeah.
For example, when you had the
especially
SARS
the 14-day
virus,
incubation.
Pardon?
I was going to say, especially the 14-day incubation period.
Exactly. Well, I mean, if you go back, and what I understand about the SARS virus is that it was actually very difficult to communicate that virus. Certainly, you can go to something like AIDS, where it was more likely that you could determine the source of the transmission. This is a very difficult one, and I think almost impossible to know ultimately where the transmission comes from. So I think in the workplace, what you're going to be identifying is how do we go back to step number one? How do we protect our workers? If someone and I think there the starting point needs to be the CDC recommendations, but you still have to think them through. There's not ever going to be a checklist for your business. The guidelines of the professionals out there are varied, but following the CDC and OSHA certainly helps. But every business is different. Obviously the problem where you have, say, just the swimming organization I work with, obviously at the moment, shared locker rooms would be a substantial problem. And one thing that people haven't, I don't think, quite grasped yet, that it was just coming, was that having a concert or a highly attended athletic event is an issue also. That's because people aren't sitting and working; they're up and yelling and screaming, and there's a certain mass of transmission that is a concern, I know, to epidemiologists of getting a significant load of the virus all in one place. And it's also simply that everybody's screaming and yelling and expelling, so they're very concerned about that. So you really, obviously it's fascinating now reading about dentists, because they're working in an industry where people are expelling droplets as part of the process. So the point is that your business has to be analyzed very carefully for its particular problems. That's why I encourage you to go to industry sources the best that you can. But there isn't going to be a checklist that's issued by the government that says, hey, here it is, and then you've done everything to be safe. You really have to put some thought to this.
Can you just force someone to stay home? And that could be a yes or no.
No. Can you if you have someone who you believe is is not meeting standards of protecting others. I would put it that way. Can you force them to stay home? Well, we do have outlaw employment. You know, the labor lawyer would say, well, where's the discrimination? Is it based on sex?
Yeah.
It's all of those kinds of things. And certainly
That's a
the
slippery
big issue
slope.
here is discrimination based on age.
Yeah.
Because this virus is unfair to the sick and vulnerable, and those are including especially the old.
Okay.
That's a big issue about how to treat age discrimination in this environment. And I don't have a clear answer for that right